The Human Sciences Research Council says HIV prevalence has declined from 14% in 2017 to 12% in 2022 nationally. Although Limpopo has the lowest in HIV prevalence, the findings also show that in 2022, HIV prevalence in the province was disproportionately higher among the 25 to 49 age group. The females in this age group have recorded a prevalence of 22.3%, males 17%. The survey revealed that in Limpopo, 11.4% of people aged 15 years and older reported having multiple sexual partners in 2022. The survey revealed that in Limpopo, 11.4% of people aged 15 years and older reported having multiple sexual partners in 2022, a decrease from 12% in 2017. Notably, 18.5% of men were 3.7 times more likely to report having multiple sexual partners than 5% of women. The highest proportion of multiple sexual partners was found among those aged between 17 and 24 years compared to other age groups. HSRC says, although the prevalence has decreased, this doesn't mean that people should not use protection, as there are only two factors that could contribute to the decrease.
The decline in HIV prevalence in a country can happen because of, I would say, two reasons, for example. One of them could be that if you have a particular group of people living with HIV, if people die because of HIV or more people die who are living with HIV than other group, then the prevalence will go down, because the prevalence is the burden of disease, is the proportion of people that live with an infection. That's one of the reasons where we can see decline. The other could be if more people are born HIV negative, because people are on ARVs, and U equals U, people are born HIV negative, so due to population growth, and people are not getting infected, then the prevalence would go down. But the numbers of people living with HIV then would remain the same because people are not dying. So we always need to keep in mind that when we see these statistics, we always need to think what could be contributing to the decline or to the increase in HIV prevalence.
The findings also revealed that HIV prevalence was high at 7.4% among individuals living in rural or farm areas in Limpopo. Mopani district in Limpopo has the highest HIV prevalence at 9%.
Vembe district, the prevalence there was about 8.9%. Mopane district, the prevalence was about 9%. And Capricorn district, the prevalence was about 8.5%. So Vembe district and Mopane district were the two districts that had the highest HIV prevalence. So the other two districts, we did not have sufficient small area layers for us to be able to have data representative in those districts. Hopefully, going forward, funding permits, we will be able to include those.
Professor Zuma says 200,000 people living with HIV in Limpopo have still not yet achieved viral load suppression. He says this is concerning as there is a high risk of HIV transmission during unprotected sexual acts with a person who is virally unsuppressed.
There are 200,000 people actually who are living with HIV in the province, but who are not virally suppressed. If you look at that, about 33% of 570,000, 200,000 people in the province are not virally suppressed. They are living with HIV and they are not virally suppressed, which means if they are having unprotected sexual intercourse, we've got this pool of 200,000 people that is likely to transmit the virus. And that should be a concern for all of us. And those are the numbers that we need to bring down.
Meanwhile, the Centers for Disease Control and Prevention has expressed optimism about the progress made by the country in combating HIV. It says findings are encouraging and suggests that the country is making significant strides in the fight against the disease. The findings also reveal that there is a decline in condom use nationally, which could roll back the gains made on the fight against HIV/AIDS. I'm Koke Jomodao, SABC News, Polokwane.